In 1998, a scientist made the accusation that vaccines cause autism, according to Froma Harap, a national columnist in politics, economics, and culture, in an article from the Post Bulletin on January 23rd of 2019. In the 20 years since, people still believe this is true. Many people in this school may not be vaccinated because of this reason. The decreasing number of vaccinations in America poses health problems for everyone. Today, I will be informing you about why the lack of vaccination use is a major problem. Second, I will be discussing a solution to help eliminate dangerous disease outbreaks. To begin, let's discuss why the lack of vaccination use is a major problem. Many dangerous diseases are resurfacing due to the decrease in vaccinations. According to Lee Ventola, a consultant medical writer in the Pharmacy and Therapeutics Journal in July of 2016, parents are choosing to not vaccinate their children to follow alternative immunization schedules instead. These alternatives can include philosophical, medical, religious, and socioeconomic reasons. Harap, as mentioned earlier, states that 18 states in America still allow philosophical, non-medical exemptions for vaccinating children. According to the Mayo Clinic staff, an organization that consists of experts in medicine, on the Mayo Clinic website on February 6th of 2019, disease risks are greatest in young children. Children under the age of 2 who have not received vaccinations has quadrupled in the last 17 years, according to Lena Sun, a national health reporter who has a master's in journalism from Cornell University, in an article from the Washington Post on October 11th of 2018. Some people choose to believe in natural immunity. The Mayo Clinic staff, as mentioned earlier, states that natural immunity comes with major risks. Some of these risks can include chickenpox, later leading to pneumonia, and even deafness can result from having mumps. Diseases that were once eradicated are now causing harm again, according to Lauren Latella, a psychology intern at Mount Sinai Adolescent Health Center, and other authors from the International Journal of Environmental Research and Public Health on March 28th of 2018. Some of these diseases can include whooping cough, diphtheria, and measles. Harap, as mentioned earlier, states that only 6 out of the 52 measles cases had been vaccinated from the Disneyland outbreak a few years back. Also, there are many controversies about vaccinations that are negative. The lack of knowledge about vaccines contributes to the reduced number of vaccinations, according to Ventola, as I mentioned earlier. False information about vaccines are often spread, giving them a bad reputation. Harap, as mentioned earlier, states that some people view vaccines as unhealthy. Some also believe they are linked to autism, when there is actually no connection between autism and vaccines, according to the Mayo Clinic staff, as I mentioned earlier. Now that you know why the lack of vaccination use is a major problem, I will discuss a solution to help eliminate these dangerous disease outbreaks. Mandatory vaccinations through proper education can help prevent disease outbreaks. Laws regarding these mandatory vaccinations need to be passed. According to Harap, as mentioned earlier, in 2016, California made a law mandating vaccinations. California is the only state that doesn't allow exemptions for vaccinating, other than for medical reasons. According to the National Vaccine Information Center, a nonprofit organization dedicated to prevent vaccine injuries and death through public education, on their website in November of 2018. According to the United States Department of Health and Human Services, an organization that protects the health of Americans and fosters advancements in medicine, from their vaccines website on January of 2018, vaccinations help protect future generations. Ventola, as mentioned earlier, states that once people are immunized, the rate of that disease is then decreased. By vaccinating, it helps protect and prevent diseases for those who have weakened immune systems and can't fight back, according to the U.S. Department of Health and Human Services, as I mentioned earlier. Also, providing positive interventions about vaccinations can help improve vaccine use, according to Ventola, as I stated earlier. Parents may not know that there are safe and effective options out there available to them. Parent and patient counseling can help improve vaccine use as well. These options will help inform people about the positive impacts of vaccinating, the consequences of not vaccinating, and it'll help eliminate the false information being spread. For example, the State Fair vaccination booth helps in vaccine awareness, according to Doug Schultz, an information officer from the Minnesota Department of Health, on their website on August 21st of 2018. At this booth, they have displays and activities there to help people learn about vaccinations. These visuals provided explain how vaccines can help people, families, and communities stay healthy. Today, I informed you about why the lack of vaccination use is a major problem. Second, I discussed how mandatory vaccinations through proper education can help prevent disease outbreaks. The decreasing number of vaccinations in America poses health problems for everyone. So the next time you hear the false accusation that vaccines cause autism or that they are unhealthy, remember that vaccines have many positive impacts on people and communities.